What's up, y'all? This is Carolina Doc PT, and look, if you are recently out of a surgery, you just had a surgery for a knee replacement, a hip replacement, if you are having balance or fall difficulties, if you are walking with a really narrowed base of support, so you don't have really good stability and are taking really small steps when you're walking, you need to be using your walker. Goodness gracious, folks. Look, we've had two people come into our clinic that within the last week have both had falls. Both were supposed to be using walkers. Neither one of them were. Look, like the walker is going to help you from a couple of different instances. So if you're somebody that is needing to use the walker because they are very unstable, if you're not walking with a good reciprocal gait pattern, so that you've got one foot going fully in front of the other and your foot is stepping completely past the other foot, then your balance is going to be off. You're going to be really susceptible to a fall. You're going to be a high risk of falls. If you're a person with a walk or person that is walking through the house, touching furniture as you walk, you're at a high risk of falls. You need to be using a walker, okay? If you're somebody who just had a knee replacement, if you just had a hip replacement, you need to be using the walker, not so much for you because of your balance, but because of the protection that you're needing to deliver to your knee or your hip. Part of the reason of using that walker after a surgery is so that you do not overwork and overuse the leg that had that surgery performed on it. I understand some of you guys, like I've had some comments even on Reddit from some of my posts or some of my videos talking about, that they were able to come off the walker really quick or assistive device really quick. And that's great. Look, everybody is going to be a little bit different. There's not a one size necessarily fits all in these situations. Everybody comes into, say, a surgery with different levels of fitness in their background. So if you're somebody that was very fit, very active, much more so than your average person, then yeah, sure, you're probably going to advance a little bit quicker. You have more muscle mass, more nerve conductivity, your balance, all of these reasons, you're likely going to progress just a little bit quicker. But that's not really the norm. You will progress usually at the rate of about 2 or so weeks. 2 to 3 is what I pretty much tell everybody, whether it's a knee replacement or hip replacement. We'll try to advance you a little bit faster than that. Hip replacements, you generally can advance a little bit quicker with that walker use. You generally will go from a walker to a cane and then to nothing at all. But the expectation, especially within the first few days, is that you're going to be using a walker. And not only are you protecting that joint, but then the other thing is you're trying to protect yourself from having a fall, because your balance is going to be off. You're not going to be walking the same normal gait speed that you would have otherwise been using. So using a walker is more of a protective device for you than anything. And protecting that leg, because you don't want to have a fall on it and you don't want to overwork it. And I'll tell you, I was talking with a buddy of mine who is also a physical therapist, and we both were in agreement on this, that we think that those folks that really progress themselves too quickly with using a walk after they've had a knee replacement or a hip replacement, those are the folks that go down 9 months, a year from now, that are having a lot more pain than other folks are, because they overworked it. They progress themselves too quickly, too fast when they're in this protective phase. I know that I mentioned this in a previous video, but we have a surgeon or a couple of surgeons in this area who, if you've had a hip replacement with them, no questions, they're expecting you to be on that walker for 3 weeks. We are not, as PTs, allowed to advance you any quicker than that, because you are being held by that surgeon and by that surgeon's protocol, because he is trying to err on the side of caution, trying to err on the side of protection, and also trying to not overwork that area, so that everything does heal right, and so that you don't have more pain later on down the road. But if you're having to use a walker because you're on the balance side of things, look, over the age of 65, the number one reason that people pass away from an injury is from having had a fall. I'm probably going to do a very specific video on just that, but this is almost kind of a rant because I had this second patient today that had a fall, and look, there is no call for this, all right? If you've been told that you need to be using a walker, use it. All right, once you are walking better, and I think you should ask your PT this. If you're not wanting to use that walker, we understand. We're working with you, trying to advance you so that you do not have to use this. If, say, 6 months ago you were not using a walker, then we're going to try to advance you off of this. So we understand that, but it takes work to get from here to there. And in the meantime, you need to be using the walker. Please stop being bullheaded. Stop just not listening. Stop being non-compliant. You're hurting yourselves. And for you folks over the age of 65, falling is potentially life-threatening for you. Why take that risk? Use your walker, people, please. Goodness gracious. All right, my rant's over. Y'all have a good one. Later.